I just put this session like an introduction to Erpm. Well, I think by this time most of you have some introduction to Erpm anyway. Just because some new students, maybe the brand new small kids, right? They wanted to have some idea about this Erpm, right? And so every day there are a few messages, like it's a little bit difficult to tell again and again the same story to everybody, So rather than I thought we'll do just a small quick session, like what is this Erpm, how to study, what to study, like how to prepare, etc. Clear? That's the purpose of this. Right, I can see some old kids as well, but anyway, right. So to start off, right? To start off, it's like this, guys, right? By this time, you may have some idea what is this. So what is this Erpm, right? So it's the examination for registration to practice medicine in Sri Lanka, right? So in other words, right? In other words, it's same like your what? If you are going to Australia, you will say AMC, right? If you are going to UK, you will say PLAB, and if you are going to what do you say US, you will say USA MLE, right? Like that. This is the exam to start practicing here. Clear? Right? That's the first thing. Now, what is this Erpm? What is the format of this exam? Right? In a second. Yeah. Fine. So there had been a change which was made recently, right? When it comes to the format of this Erpm, and which is going to be effective from the very next exam, right? Right, probably either late August, September, right, the very next exam, right? So what is the change that has been implemented, right? Or what is the format of this exam? Clear? This exam is supposed to be held, at least in theory, 2 times per year. Clear? At least in theory, 2 times per year. Unfortunately, in the recent past, there had been a lot of irregularities, right? So they had been dragging, there had been 1 year without exam. But I think and I hope it has come to an end. Clear? That irregularities won't be there anymore, right? It has been addressed in a proper way with the committee recommendations. And I was glad to see even today they had a meeting there. SLMC chairman had a meeting with the foreign students. I don't know, some of you might have joined that also, right? There was an open meeting invitation. Clear? So in other words, they are trying to make it a better place, right? And what is a more friendly exam in future. People just keep the cameras on, otherwise it's not difficult to teach. That's the thing. Clear? Now, this Erpm, right? There are 4 parts. A, B, C, D. Clear? So I'm going to touch the first 3 today, A, B, C. Like Erpm D is another part. The Erpm part A and B is considered as the theory component. Right? Erpm part A and B is considered as the theory component. Right? So this part D, right, this part D, that is the forensic medicine and community medicine, right? I'm not going to touch that, right? I think Dr. Lagat said he will be doing a session to you on Sunday. So, right, okay. So that's not the, purpose of today's session. Clear? So you initially sit for the theory component, right? Theory component, that is part A and part B. So then you will sit for part B and C. This part B and C in broad terms, it is called the Viva component. Right? It is called the Viva component. right? Out of that, this part B is called as cases, right? This part C is called as emergency viva, right? Emergency viva. Clear? Emergency viva. Right? Is that okay? Fine. Now look here, right? Emergency viva. Now coming to the part A, guys, right? Just listen. What was there earlier? What is the change now? Right? What was there earlier? What is the change now? What was there earlier was this, right? In the part A, what was there earlier was we had 4 papers in part A, right? We had 4 papers in part A. Medicine, right? Pediatrics, surgery, gynecology, and obstetrics, right? Medicine, pediatrics, surgery, gynecology, and obstetrics. Clear? Fine. So these are the 4 subjects in part A earlier, right? So if you look at these 4 subjects, right? So you have to sit for the theory exam, theory paper. If you look at the theory paper, that theory paper consists, right? The theory paper has, right, 25 questions as single best answer. Right, 25 questions as single best answer. And 25 questions as true false. Right, 25 questions as single best answer and 25 questions as true false. Altogether, there are 50 questions and you have to sit for a 2 hours and 30 minutes paper, right? You have to sit for 2 hours and 30 minutes paper. Understood? Right? So here, if you look at medicine and psychiatry, right? Medicine and psychiatry. So altogether 50 questions, no? 25 SBA and 25 true false. We had 2 questions on psychiatry in SBA, 2 questions on true false in SBA. In other words, out of the 50, we had 4 questions in psychiatry in medicine paper. So 46 medicine questions plus 4 adult psychiatry questions, right? So similarly in pediatrics, right? Similarly in pediatrics, we had 46 pediatric questions and 4 child psychiatry questions. That had been the format earlier. That had been the format earlier. Understood? Right. Now, what is the new change now is, right, okay, now this year onwards, like they have converted the system to the, like the local exams, like the local exams, like the local exams, like the local exam. Give me a second. I'll show you. Right. Clear? Look here. So it has been converted like the local exams. Okay. The psychiatry which has been part of, right? The psychiatry which had been part of medicine and pediatrics had been taken out, right? And it has been put as a separate paper. Understood? Right? Separate paper. Now, what are we going to have is, we are having 4 papers: medicine, pediatrics, surgery, genomes. Medicine, pediatrics, surgery, gynecology, and obstetrics. So if you look at these 4 papers, right, if you look at these 4 papers, understood? This is a 50 question paper where you are going to have 25 questions single best answer, 25 questions true, false. So altogether it's 50 questions. And this is going to last for 2 hours and 30 minutes each paper. Right? Okay. So the 4 questions which have been part of medicine in the psychiatry question, which have been part of medicine has been removed. Right? It has been removed. Now the new psychiatry paper, is going to consist only true false questions. You are not going to have single best answer, only true false questions, right? It is 30 questions, true false, right? Which is going to last for 1 hour and 30 minutes. Clear? Okay? Is that okay up to that point? Right, now look here. Now, how are we going to pass? Look here, guys. Right? Look here. How are we going to pass is, in each subject, if you get 45%, you will pass the exam. Right? Each subject, if you get 45%, you will pass the exam. Right? You will pass the exam. Right? 45%. Right? For 100, 45. Right? For 100, you have to get 45. Right? You will pass the exam. Now, right, look here, guys. Right? I told you, right, there are 25 single best answer and 25 true false, no? Right? 25 single best answer and 25 true false. So, right, I mean, most of the students are some may be aware, but for that, purpose is to teach the new small kids, no? Now, look here. What is this single best answer and true false? What is that? Look here. Fine. Look here. What is meant by a single best answer question is, guys, a question like this. Right? Okay. Look here. Say, just look at your first question. 25-year-old man presented with a acute onset shortness of breath and pleurotic chest pain. He is previously healthy. He smokes 10 cigarettes per day. On examination, he is tall, pyrexia, no fever. Saturation is 92%. Right? On auscultation, reduced breath sounds are noted in the right side with no V's. What is the next step of investigation? Right? We'll study later in medicine. This is a condition called pneumothorax. Right? We have to urgently do a chest X-ray. So there are 5 answers. And you have to select the best answer. Right? There are 5 answers and you have to select the best answer. Right? There are 5 answers and you have to select the best answer. Right? So, like, you have to mark the answer only. Then, like this, there are 25 questions. Like this, there are 25 questions. Then, there are 25 questions here. Right? Which are called true, false. Right? Say, for example, look at the question, causes of pericarditis, uremia, SLE, hypothyroidism, Dressler syndrome, TB, like that. So, each statement you have to mark. Is it true? Pericarditis, is uremia is a cause? If the answer is true, you will mark as true. If the answer is false, you will mark as false. If you don't know, you will leave it. Right? If you don't know, you will leave it. Right? Understood? Like that, you have got 25 true false questions. Understood? Is that okay up to this point? Yes or no? Right? Right? Okay, fine. Now look here, guys. Now, 45% is the pass marks, no? 45% is the pass mark. Every single best answer, right? Every single best answer question, right? Every SBA, if you get it right, you will get 5 marks. Right? So if you get the answer right, you will get 5 marks. So 25 into 5 is what? 125. 25 into 5 is 125. Understood? When it comes to true false, right? When it comes to true false. So there are 5 stems. There are 5 stems. Each question has 5 stems. Every correct stem will get a positive 1 mark. Right? Say you get all 5 right, you will get 5. Right? Every negative wrong stem will get a minus 1 mark. Like say you get 3 right, 2 wrong, like 3 right, 2 wrong, plus 3 minus 2, your final mark is 1. Right? Every wrong stem will get minus 1 mark. So if you don't attempt, there is no marks for that stem. Say you mark only 3, that all 3 right, other 2 you have not attempted, so your marks is 3. Your marks is 3. Clear? Right. You get 2 right, 3 wrong, you get 3 wrong, excellency is too good, like the minimum marks for a question is 0. Clear? The minimum marks for a question is what? 0. It's not minus 1, it is 0. Right? The negative marks is not carried to the next question. Understood? Fine. Now look here. So this is the exam format. Right? Fine. Now look here. Now, what shall we do to pass the exam? The next question now. Right? What are we going to do to pass the exam? Right? That's what you asked me, no? You send me messages to ask that. Well, I strongly believe it is the single best answer decides the pass. Clear? Single best answer decides the pass. Right? Say for example, if you get 15 single best answer right, like 16 best answer right, so like yes 20. So the 5 is like this, every right stem will get right 1 mark. So 25 into 5 what? 125. 125. What is the total marks? 125 plus 125 is what? 250. 250. What is the pass marks? 45%. That is 112.5. 112.5. Okay. Right. I strongly believe, guys, SBA decides the pass. Clear? If you get 15 out of 25 single best answer, right? 15 out of 25 single best answer, you have got 60% marks from the single best answer. Right? You have got 60% marks from the single best answer. Right? So you only need 30% marks from the true false, right, to get the total as 90% divided by 2, 45%. You got that? Like if you get 60% of your marks in the single best answer, you only need 30% of the marks from what? True false. Right? True false. Right? So you get 60 out of 100 for SBA. Like if I go for 100, right, you get 30 out of 100 for true false. So 60 plus 30, 90, right, divided by 2, 45%. Understood? The single best answer checks the understanding, right? Understanding of the subject, right? So if you don't understand, you can't do. If I tell in simple terms, even if you look at the Kumar and Clark and answer the question, like you can look at the book or you can look at the phone and answer the question, it will not make any sense. Clear? Because all 5 answers are there. Like all 5 answers are there. Right? All 5 answers are there in Kumar and Clark, all 5 answers are there in the paper. But the question is asking about what is the best management for this patient. Like this patient is having heart failure. What is the management of heart failure? Right? All 5 answers are right. All 5 are management of heart failure. All 5 are there in Kumar and Clark. But the question is, what is the best management in this patient? Right? Kumar and Clark will talk about heart failure. But Kumar and Clark is not going to talk about heart failure in this patient. Understood, guys? Right? So that you have to understand. That you have to understand. Right? And me in my classes, like, I mean, now it's about more than 8 years. Like, I started at, 24 years, the class. Right? I put a lot of emphasis, like, I put a lot of emphasis in SBA. Like, I put a lot of emphasis on SBA. Because I strongly believe SBA decides the pass. The problem with true false is, guys, like, whatever said, we'll forget, no? We'll forget. Like, so if we forget, you can't mark because, right, when you mark it wrong, it's negative. Like, when you mark it wrong, it's negative. Right? So you can't go and mark 125 out of 125 true false. It's not possible. Even we can't mark. Right? Right? So the marks is mainly dependent by SBA. I will teach in my class as well. Clear? So if you look at the last time, there was an exceptionally brilliant batch, the last batch. Like, it was an exceptionally brilliant batch. Right? I think 70s and 80s were nothing. Right? Maybe about 10 students were there with a SBA 23, 24 out of 25. And the highest marks for all subjects has come from medicine, 82 marks from a Manipal guy. Right? He got 82 for medicine. Right? The highest in all the subjects in the theory. Right? The fellow is exceptionally brilliant anyway. Right? So all those people, right? All those people, they scored a very high SBA. Very high SBA. Like, and if you want to get a good mark, if you want to get a good rank, like, you have to target a very high SBA. So we'll try our best to make each of you to have about 17, 18 SBA minimum. Like, if you get 18 SBA, 72 marks in SBA, you just need 18 marks in true false. That will come by just sitting in the exam hall. Like even if you don't know medicine, you can mark something, no? Right? So it will come. Right? Understood? Right? So that's the exam format. Is that clear? How to study and those things I will teach you. Are you okay? Anything you want to ask at this point? Right? Come on, guys. Like, if you want to ask, because this session is actually, I just put it just for your sake, because there's no reason for me to come and do a session like this. Like, and I don't have a paper class today, so I'm free today also. That's the other reason. Yeah? Like, okay, nothing else to ask. Can I move on? Right. Okay, fine. So, that is the first subject. The psychiatry is going to be a, like, 30 question, true, false. It's only true, false. We don't have an SBA there. Right? We don't have an SBA there. Right? SBA there. Clear? So that's it. Now, if you pass the medicine and pediatrics, like, if you pass medicine and pediatrics, you will be able to sit there Viva medical tract. Right? Viva what? Medical tract. It's called Viva medical tract. Similarly, if you pass the surgery and genops, right, you can sit for the surgical tract Viva. Surgical tract Viva. Right? Okay. Surgical tract Viva. Look here. Right. Fine. Look here. This is what I told you. Like, how to proceed for part B and C of the, right, ERP. How to proceed for part B and C of the ERP. So if you pass this medicine and pediatrics, you can sit for the medical tract Viva. That is this. If you pass the surgery and genops, you will be able to sit for the surgical tract Viva. Surgical tract Viva. If you pass all four, you can sit for right both medical tract and surgical tract. Right both medical tract and surgical tract. Clear? Right. So in other words, your part D, or what you say, psychiatry, is not going to affect whether you are going to sit for the Viva or not. But it will affect, right? It will affect, but it's not going to, right, decide whether you are going to, right, to say sit for the viva of the track or not is not going to be depending on that. Clear? How to study the part A and those things I'll come. Before that, I'll just quickly tell a few words about this. What you say, part B and C, right? Part B and C. This is the viva, part B and C, right? Okay, right. So what is there in the part B and C is, right, look here, if you pass the, what your medicine and pediatrics, you can sit for the medical track viva, medical track viva, right? So what is this medical track viva is, guys, right, okay. So here it is called, right, here in our local terms, it is called the cases, right, the cases, right, cases. So here, if you look at medicine, the same for pediatrics also, there are two stations, right? There is a station 1 and there is a station 2. There is a station 1 and station 2. Clear? Station 1 and station 2. Right? What is the station 1 is? The station 1 is the one which is called as long case. Right? The station 1 is the one which is called as what? Long case. Simple term is long case. Right? What is this long case is? Like it's a 20-minute station. It's a 20-minute station. It's a 20-minute station. Right? So you go there. Right? You go there. There will be a patient in the bed. There will be a patient in the bed. Right? You are not going to touch the patient. Right? You are not going to touch the patient. Right? You are not going to touch the patient. You have to get the history from the patient for 10 minutes. Right? 10 minutes. You will talk to the patient. Then right? So, right, then you will go into that. You are going to take a history from the patient for 10 minutes. Right? Right. I will talk about it later in the when you are coming to Viva. Right? I will talk a lot about that there. Right? 10 minutes we will take a history. After that, 2 minutes you will be allowed to prepare. At least in theory, you will be allowed to prepare. Right? Next 8 minutes, you are going to discuss about the patient with the examiner. So 10 plus 10, altogether 20 minutes. Right? You are not going to touch the patient. Right? You are not going to examine the patient. It's just 10 minutes talking with the patient. Right? You will talk to the patient. You will get the history. So after 10 minutes, the examiner will ask you, okay, can you tell me a summary? What do you think is the diagnosis? What are the things you are going to see in your examination? You are not going to examine, but you are going to tell, right? What are the things you are going to see in the examination? How are you going to investigate this patient? How are you going to manage this patient? Like that. Clear? Right? We are not going to touch the patient. Right? Like that. Right? Station number 1, 20 minutes. 10 minutes with the patient, 10 minutes with the exam. The station number 2, right? Station number 2, right? This is called short cases. Right? This is called what? Short cases. Short cases. Here, right? The first station only talking, no touching. Right? The first station only talking, no touching. Here, no talking. Right? Here there is no talking, just you examine. Right? Just you examine. Right? Right? So you have to examine 2 systems. Right? Depends on your luck. Right? It can be a cardiovascular system, respiratory system examination, abdomen examination, or it can be a nervous system examination. Right? In the nervous system, it can be cranial nerves, lower limb or upper limb. Don't worry about it now. Right? So you have to examine 2 systems. Right? Right? 2 patients you will examine. Not talking, just examining and coming to a diagnosis. Right? Understood? Right? So 6 minutes to examine, 6 minutes to examine, 4 minutes to present. Right? Like that too. Like that too. Understood? Yes or no? Right now. So there are two no. Like 10-minute station, two. Right, two. How to pass this? How to pass this part B? Right, station number 1. There are two stations in the station number 2. At each point, you have to have a minimum 45 marks. Right? At each point, you have to have a minimum 45 marks. Clear? You have to have a minimum for 45 marks. Right? With the average of 50 or more. Right? At every point, you should have a minimum 45 marks. At the average of 50 or more. Right? Clear? Right? So if you are getting 45, right? Okay, next also 45. The third you have to get 60. Then only average will come to what? 50. Right? To pass the exam. You get 90. 90. This is 35. Right? Right? This station 90. This station 90. Right? Already you got more than average is 60. But then this station 35. Understood? Right? Minimum 45 at each station. With the average of what? 50 or more. Got it? Right. The next point. Look here. So this is same for medicine, pediatrics, right? Same. There's a small difference in general-ops, right? And there's a small difference when it comes to surgery as well. Are you okay, guys? Right? So that's about that. Right? That's about that. Then the third part is called part C, right? Third part is called Erpm part C, right? So once you pass, if you are sitting for the medical track means, right? So you are sitting for medical track means you have passed medicine and pediatrics theory, right? You are sitting for the medical track Viva means you have already passed the medicine and pediatrics theory. What is the third part is called part C, right? That is called emergency medicine, right? Emergency Viva. Emergency Viva. It's a 20 minutes Viva, right? It's a 20 minutes Viva, right? It's a 20 minutes Viva, right? So you will ask 10 minutes about the medical emergencies, then 10 minutes about the surgical emergencies, right? Surgical emergency. Have some idea, don't worry too much about the part B and C now, right? Okay. Are you okay, guys? Right? Right? Fine. How to study and those things, I'll come back to that, right? Is everything is okay up to this point? Come on. You ask me because I won't be doing the similar session for another next 1 year. I think last year, this time I have done one. Yeah, okay, fine. Look here. So that's clear, right? Okay, fine. Look here. Now, I'll come to how to study and what are you going to do in the class. Now, guys, the purpose. Now, the exam is tough. Exam is difficult. Those are stories. Those are stories. SLMC pass only this percentage of people. Those are just stories. Like the buggers who have failed have to come up with a reason, no? Right? So you have to come up with a story. So they came up with the different stories. Clear? There is nothing like that. There is nothing like that. If you do, you will pass. Computer will mark, you will pass. As simple as that. Right? Well, there had been some issues with the examination. They were not held on time. All those were there. But it won't be there anymore. This COVID is a different story, which affects all over the world. The rest, it's not right. I hope it's going to be there in good hands in future. Right? There are very good positive signs. Right? We are going to have the Viva next week for those who are remaining in Colombo. Right? So, it's a very good thing. I mean, out of the last 8 years, this is the first time I'm seeing there's a positive thing. Right? When it comes to Erpm. Right? Now, the exam, right, guys, look here. More than 90% will pass. Okay, more than 90% will pass. Right? I'll tell about this, how to study and those things. But whether you study or not, right, from your point of view, whether you study or not. If you study, that's good. You'll anyway pass, no? We'll make sure 90% is passing from our side, right? The only reason is we don't want our student to fail because that's not good for our name, right? So even the last batch was a combination of two batches, like two batches. I think for my class about 430 set for the exam, like 430 set for the exam, almost 400 odd passed. Like I had about 985 or 99 for the 89 for the Viva class, including juniors. Right, so about maybe about 30-40 might have failed, but those also the students who came late, they had enough issues. Those who are thinking they are not going to sit for the exam, last time they got the approval like that. Right, so passing is not an issue. The second thing, the important thing is we have to pass with the highest possible marks. Highest possible marks. So what is meant by the word highest possible marks? Right, highest possible marks. Even if I am given the second chance to sit for the exam, I can't score more than this. Right, I can't score. This is my max. This is the maximum I can do. Right, this is the maximum I can do. Right, that's what meant by the highest possible marks, because that's the most important thing. You will anyway pass, guys. Right, so somehow by telling, right, like I used to tell, right, mitral stenosis is a mid-diastolic murmur, mid-diastolic murmur, mid-diastolic murmur, mid-diastolic murmur. Right, sometimes you don't know what is mitral stenosis, but you will go and mark the answer what mid-diastolic murmur. That's right, no? That's right. So those are a group who will come and tell us, I don't know how I passed. Right. So the reply, I will also reply, you also don't know how you passed, but it doesn't matter, you passed. Right? Understood? So, right, by the section-wise papers, final papers, telling the same thing again and again, right? There's something called student monitoring system just to see whether you are going in the right path or not. Right? They will, right, if your marks is going low, they will tell me, right, your marks is going low. So have a look on this. Right? So, right, there is a way to make you pass. So don't worry about that. So the important thing is, right, passing from the highest possible marks. Why it is important? And why it is important to pass everything in the first time? That's the next question now. Well, there is something called merit list. Right? There is something called merit list. Unfortunately, the last merit list, we don't have Erpm students. Only about 10 or 12 repeat students who have repeated the exam 2-3 times earlier, who had some remaining part right there, they went because they had some theory left or something, they went. We didn't have a proper Erpm batch, right? So before that, we had the last Erpm, right? That is about more than 1 year back. We had finished the internship about 2-3 days back. Clear? This merit list, whether you like it or not, unfortunately, you will be placed after the local graduates. Right? Local graduates will be there on top of the merit list. That is right or wrong, I don't know, but that's how it's going to be. Right? We can't change that now. So after, say, sometimes, right, there are 1,000 local graduates going for internship. Right? If it's a repeat batch, there are 200 local graduates going for internship. Clear? Right? So after the local graduates, there will be KDU students. Right? There will be KDU students. So after them, right, after them only, you will be placed. Right? You will be placed. Understood? Right? Right? So the first of the Erpm will be there after the local graduates, KDU, then only Erpm at least will start. So why this is important is, right, you will come to know this later, right? There is something called, in the internship, you have to select 2, medicine, surgery, pediatrics, genops, right? Or sometimes in the Columbus Center, there is option called pediatric surgery, right? So if you want to do the areas you like, say this is MBBS, right? Bachelor of Medicine and Bachelor of Surgery, and I hope you will also feel the same, right? At least most of you want to do medicine and surgery in the internship, right? You don't want to do a PV for the rest of the life, right? Okay. So, right, this majority may want to do the medicine and surgery for the internship, isn't it? So, we have come across even a lot of students, I mean, they are small girls of this size, like this size. So when I ask them, they will ideal candidates for pediatrics because they look like kids anyway. Like, what do you want to do in the internship? Like, so I want to do medicine and surgery. Like, okay, you want to do medicine and surgery. Like, so what do you want to do in future? Like, so I want to be an orthopedic surgeon. Right, right. It's like, but the fellow is only this size. Like, maybe you have to stand in a table and do the surgery. Right, but that's okay. All in the game. Right, that's okay. Right, for all those things. Right, it's important to have a good merit rank. Got it, guys? Right, merit rank. Right. So how this merit rank is calculated is, right, I'll just quickly show. It's important to, this is all calculated, guys, right? First, they will put, like, part A for 500 marks, part B for 400 marks, part C for 200 marks, part D for 200 marks, right? Part A, 5 subjects, no, 100 each, 500. Part B, 4 subjects, no, 100 each, 400. Part C, 2 emergencies, no, right, 100 each, 200. Part D, combat forensic, 2 subjects, 100 each, 200. So total 1000, 300, right? Then they will look at the attempt. Like, if you pass, like, all the first attempt students will come in first. Second attempt students will come in the second time. Then the third attempt, like that will be counted. Like that will be counted. So that's why it's important to, pass all in the first time, right? All in the first time, because even if you are left with a subject, right, you will be coming under what? Right? Second attempt. You got it? You will be coming under second. Sure. Your marks is, right, 90 for 3 subjects, but only 1 subject you failed, a minor subject or something you failed, right? But another fellow has got what? 45, 45, 45, 45 in all 6 subjects and passed, right? You got 90 for 5 subjects, but you got 44 for 1 subject, right? But the other fellow got only 45, 45, 45, 45 and passed. Viva also, that fellow got 45, 45, 45, 45 and passed, right? But you scored exceptionally well in all the subjects, just missed 1 subject, right? So your attempt is going to be counted as what? Second. You got it? Yes or no? Is that clear? Right? So that's why it's important to pass, right? So that decides where you end up, right? So, are you okay, guys? Anything you want to ask here? Come on. Huh? Yes. If you have anything to ask, tell. Right? Right? So this is the last time merit list, right? Last time merit list, right? So I think out of the first 12, only 1 student was not there in the class, like first, second, also the third, right? This is the fourth, right? 25th, right? Right? 6th, 7th, 8th, right? 9, 10, 11, 12. Only 1 is not there in the first 12, I think fourth or something, right? So the first top students here, they were able to do medicine and surgery. They finished the internship yesterday or day before yesterday, right? They were able to do medicine and surgery in the last internship merit list. Clear? So if you have an intention to do like that, so you have to score as much as possible. Right? Clear? Right? So you have to come up, because sometimes, like, say you are from a good university, right? You are from a good university, you are, right? So, right, those people will be able to pass the Erpm without any classes. Right? Right? You may not have to, but they are coming for the classes, right? Only reason is they want to score more and more. Like, instead of passing with 60, they want to pass with 90, right? So that's the important of the merit list, because this merit list will come, till you, right, finish this medical profession, right? Whether you are going to be as the house officer Panadulo or house officer Batalangundu, right, will be decided by the merit list. Understood? Right? But both have some advantages and disadvantages. Right? Even Batalangundu is not bad. Right? Okay? Is that clear? Right. Now, how to study, what to study, where to study. Well, the earlier, guys, I look here. Before this COVID, these online classes were not there, right? So majority comes to the class after they passed out, right? Or when they are in the final years. But with this COVID, right, even the pre-departures have started to come. Right, pre-departures have started to come. Those who are not gone to university yet. So if you are a junior, like normally, like what we used to tell, right, what I used to tell in the class is, like, if you have passed out and come to my class, I will tell, okay, now you don't have time to read a textbook, right? You go through my notes, right? You go through my notes, you go through my questions. That is far more enough to get 90, 92, right? Right, if you go through those itself, right? Because the reason for telling so is because you don't have a time to read the book. Once you pass out and come, you don't have a time to read the book now. But now there may be second year students here, third year students here, I don't know, fourth year students here. In your case, it's different. Like now you are having time to read a book also in addition to the class because you have time, you have time. So when you are coming to the class in the third year or second year, you may not be able to understand the 100%. You should not understand. If you understand all 100% in the second year, that's abnormal, right? So you understand 60% in the second year or 30% in the second year, right? You come next year because once you come, it's free, no? Right? You come again next year using the same attendance. Next year, you know another 20%. So 30% when you come to the third year, now you know 50%. When you come to the fourth year, first semester, it's 80%. Like fifth year, now you know 100%. Like you know 100% when you come to fifth year. By the time you come, and sit for the Erpm, you know basically everything. Right? You know basically everything. Like there are a few students here, like the second years, third years, like now they have come because 5-6 times restreaming they have come. Right? Because they can come any number of times, whenever there is restreaming, they will come. Right? So by this time they know everything. They know everything, right? That's how it goes, right? But if you are a junior, right? Look here, guys. If you are a junior, right? If you have time, it's okay to read a book. It's okay to read a book, right? It's okay to read a book. If you are reading a book for medicine, right? If you are reading a book for medicine, there are books called, right? There are books called textbooks, right? Textbooks, right? So you can read one proper textbook, right? There are two textbooks mainly used. One is called Kumar and Clark, other one is called Davidson, right? Davidson. I usually advise my students to read Kumar and Clark because I feel it's better. Like I feel it helps the exam when it comes to questions also, because sometimes some questions are directly from these textbooks, right? But even if you don't read, you will pass. It's a different story. From the class itself, you will pass. But if you are a junior, if you want to read a textbook, I should not tell, no, you should not read a textbook, right? Right? You can read one of these textbooks. I will prefer Kumar and Clark. Understood, guys? Right? Yes or no? It's a textbook, right? Then, how to examine a patient, right? How to, elicit a physical sign, the Viva classes, right? Viva classes. They are, right? Viva classes, there are books called examination books, clinical books, right? Tell some clinical books, you know. Tell. You read or you heard? Unmute and say, guys. Answer. Nikki, say. Malaysia, what's the book? Huh? Clinical books. What? Huh?
It's Davidson, sir.
No, that's a textbook, no? For the clinical examination?
MacLeod's.
Yeah, okay, fine. Anything else?
Hutchinson's clinical methods.
Hutchinson's, okay. Well, guys, look here. It doesn't matter. When we were students also, we were told Hutchinson, right? MacLeod, right? Hutchinson, MacLeod. Those are the standard recommendation by our teachers because Like, those were the books for the old generation, right? Those were the books for the old generation. I mean, the old generation teachers are aware of that, right? So they used to recommend that. But I personally will advise you, like, if you want to read an examination book, read this one, right? Tally your corner, right? Tally your corner, right? So when I was a medical student, I came across these books only in the very later part of my medical faculty, like maybe end of fourth year or fifth year, because nobody is aware of this book those times. Like, nobody has recommended this, right? But if you're a kid here who is listening to this lecture, like, the book I will advise you is Tally Your Corner. Like, this is far more better than any of the other textbooks. Like, so yeah, other examination books. Clear? Like, Tally Your Corner. Like, if you are a junior, it's better to you buy one and keep. Right? It's worth. Understood? In addition, right, we will teach you in the Viva class, right, we will teach you in the theory class, Viva class, how to interpret an ECG, etc. Right, how to interpret an ECG, etc. We will teach in the class, don't worry. But if you are jobless, sir, I am in the third year, but I have already come to your class several times. Right now, I remember word by word. Still, I have some time. What can I do? Right, but I will first advise, like, yeah, you can, go and sleep and do something else. So go and learn some icing or play violin. Learn those things. So those are also important. No, I know that also, still I have time. What can I do? So if you want to read, these are some additional books you are reading when you are jobless. ECG Made Easy. I always advise my students, once the exam is over, before they start the internship, just to go through this book before you start practicing as interns. Very good book, simply readable. Then, similarly for X-ray, if you want to read, there is a book called Chest X-ray Made Easy. Clear? So, okay, if anybody wants to, have some additional reading, I mean, these are for you. Okay. Now. So the class pattern here. So initially we'll do theory classes, guys. So what is theory classes? We'll study a topic. Immediately we do questions. There's a difference here in my class compared to the other classes. Other subjects you don't do like that, I think. Here, when you study ischemic heart disease, there itself we do questions, because I always feel you have to know what will be asked in the exam. There's no point in just reading a theory without knowing what is going to be behind the question. These classes will be there in 3 sessions, session 1, session 2, session 3. Session 1 is GI and hepatology and infection and endocrine. Session 2 is the rheumat part 1. Session 2 part 2 is neurology. And the session 3 is cardio, SP and F4. For the new students who want to join, it will be starting from next week. Session 1 restreaming, then session 2, session 3. And the advertisement is not the purpose of this class, so I'll skip that part. So then after that, we'll do a section-wise papers, 4 papers. That's enough. Because I have done about more than 1,000, 1,500 questions in the class itself. Section-wise papers. So once you finish the theory, you can come for it. Once you finish, if you are second year, third year, you don't have to come. In the 4th year, you can come for that. Section-wise papers. And when you are in the final year, you can come for the final papers. Clear? So, theory, section-wise papers, final papers. So there are 3 sessions like this when it comes to the class format. But each topic, there will be theory followed by question. There will be theory followed by question. I don't know if you want, I can show some notes. So that's about that. That's about that. Anything else you want to ask here? Ask us, because I think this is the only time I'm having time. I may not have time later. Come on, guys. Yeah, okay. I'll unmute and ask it. We can do it. Well, do anatomy knowledge is important. Physiology knowledge is important. Answer for those questions is, you have to know some basics. You don't have to have each and everything. but at least some basic idea, like at least some basic idea, like of anatomy, it's better to know. At least some basic ideas of anatomy and those things better to know. Like you don't have to know each and everything, but some basics of anatomy, basics of physiology, those things you have to know. We'll teach you. Like then and there in the class itself, we'll tell you. Like we'll have an anatomy and physiology, right? But like some basics at least you have to know. Like physiology, pharmacology is same, right? The other thing, since because you are worried or anything, even if you don't remember, don't worry, guys. Right? Don't worry. Right. So when it comes to classes, like we'll assume you have not gone to the university, right? Even if you are not gone to the university, it doesn't matter. Right? It doesn't matter. Provided you have a certificate and can sit for the exam, we'll make you pass. As simple as that. Like, but at least once it has started, you have to work. Right? You have to work. Right? Okay. So it's not a difficult thing to make a donkey into a horse. It can be made. Like you can convert a donkey into a horse. For that, the only important thing is the donkey also should not go out and tell, I am a donkey. Right? Donkey also should behave like a horse. Got it? Right? So that's about that. Right? So that's the thing for that. Okay, textbooks, reading, and those things. Look here. The one more thing. Yeah. Fine. Look here. Say this is how it will be. Like for example, like if you take ischemic heart disease, we'll study the theory first, like theory of the ischemic heart disease, like theory of the ischemic heart disease. So immediately once you finish the theory, right? Once you finish the theory, we'll do the questions, right? Like once you finish the theory, we'll do the questions then and there, right? So later there will be section-wise papers and final papers there. Clear? So that's about this. That's about this. Right? Fine. The next thing, the theory, right? The theory, right? Somehow we can teach people cameras on, guys. Otherwise, I can't see your expression. I don't know. You understand or not? We can teach and bring your knowledge. The only issue you faced earlier, right? You faced earlier was majority of the foreign universities, right? You feel the clinical exposure is not adequate, and in a way, it's true also. It's not adequate, right? So I know I personally have been visiting Russia to lectures there to give lectures. I think those who are into and those people may be aware when I was there, right? So your medium is an issue, right? Medium is an issue, right? You can't get a history from the patient, right? Whatever said, all are not good in the Russian also, no. Like similarly, the same applies in the Belarus as well, right? Right? Well, the Chittagong and UST to a certain extent is okay. Manipal, if you've done the internship again, it's okay, right? So, well, if you look at a local graduate, right, they basically live in the hospital. They basically live in the hospital. So to counteract that, from our point of view, what we'll do, right, we have the clinical sessions. When the Viva starts, we have the clinical sessions. Right, the clinical sessions followed by individual examination. Right, I may have some slides. Right, followed by individual examinations. Right, so you have to examine in front of us. Right, you have to examine in front of us. Right, you have to examine. Right, and show us. Right, you have to percuss. You have to palpate. Right, from A to Z. Right, like the last time a lot of juniors were also there. Right, we'll do. Right, so we have our own setup, our own bank of patients. Like our own banks of what is the examination methods, so there's no way you can skip, guys. Like somehow you'll be caught. If you are weak, you will be caught somewhere here, right? So then and there you'll be corrected, right? So because those days we thought of okay, guys, yeah, right. So I think the last time, during the vacation, can you hear me? Yeah, okay. Even for the juniors, we had clinical sessions, right? Those who have people have come from a Viva class also, they came for the Viva clinicals. Plus for the theory students also, we had about 2 or 3 clinical sessions, right? I don't know whether this is possible this vacation. Like if there's a possibility, we'll do. Like because of this COVID issue, I don't know whether it's possible. Because last time there were 500, 600 were there in each practical. We'll see. Right? If there's a possibility, we'll do. Right. Anything you want to ask us there? Tell. Yeah. Any questions? Ask us before moving on further. Yes, nothing. No issues, no doubts. So 1, 2, 3, 4 section-wise papers, final paper Viva. Are these sections we taken already? Yeah. It's like that. Yeah. Is it a must to have read all the books you have mentioned? No. Nothing at all. Right? As I said, it's not a must to know these name of this book even. Right? It's not a must to study right at home. Right? Nothing is a must here. Right? But only thing is when you come to the class, at least those 4 hours you have to concentrate. That's the only must. Right? Right? The rest we'll do. Right? Rest we'll do. Right? Right? So nothing else is a must. Clear? So that's about that. Fine. Now, so that's about medicine now. Do you want to ask anything, guys? Any doubts? Tell. Huh? Will they have theory and Viva exam both again this September? Right? The Viva is finishing on August 6th. Right? August 6th. Right? So once the August 6th is once the August 6th Viva is over, we have the theory. Right? Then for the theory, we have Viva. Right? Do we have to prepare for Viva classes? It's like this, guys. Right? Now the Viva classes, last time also, like say only 400 were sitting for the exam, no? So 980 were in the class, so 580 were juniors. Right? The reason for they are coming is free when they come again. That's one reason. Second is they can go and apply that in the university. As simple as that. Right? And they will come every year and they will master that. That's the only reason. Right? So those are up to you. But like if you finish the job, it's done. Right? And you can come any number of time and you revise and go and prepare and go and take a history like that in the uni. Right? Okay. Right. Look here, guys. Now, coming to the psychiatry. Right? Coming to the psychiatry. The psychiatry, earlier, the psychiatry, about 85% is adult psychiatry. 15% is pediatric psychiatry. Earlier, the psychiatry was 8 marks medicine. It was 8 marks in medicine paper, right? And 8 marks in pediatric paper. So when it was 8 marks, right, I used to do the psychiatry as a free classes as part of medicine classes. Right? The difficulty in psychiatry is pharmacology. Right? The difficult part in psychiatry is pharmacology. It's huge. So earlier, when it was part of medicine or pediatrics 4 questions, they did not go in depth in in pharmacology. But now, once the psychiatry is a separate subject, it's going to be a full-blown paper, no? It's going to be a full-blown paper, right? Still, we don't know how the paper is going to come. Still, we don't know. We don't have a past paper. Right? So only after the next exam, we'll know how the past paper is going to be there, right? But whatever it is, you have to study it properly, right? So that's why I removed that from my medicine. I have started that as a separate thing, right? It's about 20 topics, right? In one of my advertisement is there, photo, right? It's about 20 topics, right? It's about 20 or 22 topics, right? Even though these are the 20 or 22 topics, schizophrenia, depression, bipolar, dementia, OCD, anxiety, like that is going on, right? 20 or 22 topics. The 21 topic pharmacology, right? 21 topic here pharmacology is, if you look at the percentage, this 21st topic pharmacology is not 1 in 21, right? It's not 1 in 21. This 21st topic, the pharmacology, I will say, the other 20 topics is, say, if I put the other 20 topics 60% of psychiatry, I will say this pharmacology 40%. Right? You got it? Right? So earlier we were lucky, right? Because we had only 4 questions now. there have been no much farm, right? But that's not going to be the scenario anymore, right? So this 20 will cover, 60%. This pharmacology will cover another 40%, right? But still we don't have a paper. So the current psychiatry, I will start a restreaming hopefully soon, right? Maybe in another, I think currently is going on. Once it is over, it will be started again, right? So it's about 8 or 10 paid classes, the rest are free classes, right? So basically, right, we don't have a past paper, right? So the 5 classes have been done, right, on book 1, right? 5 classes have been done for theory, right? 5 classes have been, right, theory classes, right? This is a book 1. This is the first 5 classes is theory. 5 classes is far more enough for theory, guys. It's far more enough for theory because the same theory we taught in 2 classes earlier, right? It's the same theory we taught in 2 classes earlier, right? Right. So now it's converted to 5 classes because it's a separate subject. You have to go a little bit deep. So this book 1, about 200 pages, right? Book, right? It will be covered in basically 5 classes, right? So the next 5 classes, right, will be your questions, right? It's only true false questions, right? So we don't have an Erpm paper. So how this 600 question book has been created is, right, it has been created with the local questions, local university final MBBS question, and local universities are having a psychiatry module questions, right, and the KDU questions, because we don't have a Erpm question in psychiatry yet, right? Once this paper is out only, we are going to have the Erpm question in psychiatry. So it is 600 question, this book. So once this is done, I have not done the last 2 classes. I will do it all together maybe, right? So there are another 3-4 classes, 3 classes on the recent local papers, right? So the last time local university paper, last time KDU, there are about 4 papers to be done, right? So about 14 classes will be there, maybe about 10 paid for free, something like that, right? So that is far more enough for psychiatry. But the only issue with the psychiatry is, look here, guys. Earlier, when it was only 2 classes in medicine, right? So I told the students, you don't have to go and study psychiatry at home, right? You don't have to go home and study psychiatry. Whatever said in the class, we will teach like examples and stories, right? Examples and stories. Those examples and stories is enough to pass, get all 4 questions right, right? All 4 questions right, right? All 4 questions right. But now, since it is a separate subject, you have to study something on psychiatrics. The simple reason is, guys, look here. Aspirin, enalapril, enalaprils, 100 times we heard this word now. Right? Aspirin, enalapril, 100 times we heard this word. What are the side effects of aspirin? What are the side effects of enalapril? Right? Okay. What are the side effects? Right? What are the indications? You have heard. Right? So years and years you are studying in the university, you are studying in the medicine class, you are studying the section-wise paper, final paper, like that you have heard. Right? You have heard. But if I ask the same thing for quetiapine, if I ask the same thing for clozapine, right, the names are not familiar. Right? Names are not familiar. Right? Because we don't use that much now. We don't use that much. And fortunately, up to the last exam, we didn't need that. Right? That was our good time. Right? They didn't ask that much. Now only this new subject, new problem has come, but this time it will be there. Right? This time it's going to be there. Right? Because since it's a separate subject, olanzapine you have to know. Right? Amitriptyline you have to know. Right? So we know amitriptyline, but we don't know amitriptyline to the level like aspirin. You got it? Right? So that's why I told my students who have already attended my psychiatry class to come and sit again for the restreaming. Every time when I am restreaming. The only reason is they heard aspirin 100 times from me. Even they have not heard amitriptyline, right, 3-4 times from me. You got it? Right? Right? If you, other than these 2 books, what we are doing in the class, if you want to read the textbook for psychiatry, right, okay, there is a book called Oxford Handbook of Psychiatry. I have not put a photo here, unfortunately. Oxford Handbook of Psychiatry. It's a green color book. Right, the cover page is a green color cover page. Oxford Handbook of Psychiatry. Clear? So if you want, you can read that book. If you are a junior, if you have time, you can read the books. Like Oxford Handbook of Psychiatry. Clear, guys? The other problem with the psychiatry is, guys, now, I told you when it comes to medicine, we have the SBA, no? SBA is a PowerPoint. Like, SBA is our strength. Like, so almost all the students in the class, like, somehow we'll make them better at SBA. Like, so they will anyway pass. But unfortunately, when it comes to psyche, we are not going to have the SBA. Like, we are not going to have the SBA. Right? So later, all those problems will come when you sit for the exam only. Like, so these drugs names are also not very familiar. These are not the drugs we are using day to day. Right? When we are not sure, we can't mark. Like, so it's a true false, just a true false paper. Like, so if about 6-7 true false are going in negative, right? Right? There's a high risk of failure. Right? So that's the issue there. Right? So that's about that. So Erpm part A, part B, part C. How to study? How to study? Well, if you are sitting for the next exam, if you have not completed theory, still there is time. At least more than 2 months for the exam. At least more than 2 months. So this Viva itself going until August 6th. After that only, you have to call for application. Right after that only, so at least more than 2 months for the exam. Still you can complete the theory, no issues. Clear? So the way to study is like this, guys. When you start a topic, say ischemic heart disease, right? Ischemic heart disease. There, first you have to look at the questions. Like, first you have to look at the questions. What has been asked in the question? Right? What has been asked in the question? Now you have to look at the ischemic heart disease theory note, right? 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 Ischemic heart disease theory note, and study. And when you study, you know, like when you study, you know, right? When you study, you know, right? This has been asked in the question. This has been asked in the question. This has been asked in the question. Right? This has been asked in the question. Clear? When you study, you know, this is asked in the question. Right? So you have to put some more emphasis on that. You have to put more emphasis on that. Right? So question, theory. Again, you come and do the question. Question, theory, question. That's the way to go. Right? A subject reading should be like that. So if you study ischemic heart disease in 4 hours today, after 1 week, you should be able to, after 1 week, you should be able to revise in 2 hours. After 1 month, you should be able to revise in 1 hour. Right? 1 week before the exam, you should be able to revise in 30 minutes. The day before the exam, you will revise in 2 minutes. You know, these are things they will ask. Right? So that's the way to study. Right? Fine. Don't stress too much. Like, Erpm is not live. Right? Anyway, you will pass. Clear? Right? Before winding up, anything else you want to ask? Because just for a small number of students, I agreed to do this. Anything you want to ask? Any questions? Anything? Nothing? No. So shall we wind up? Yes, guys? So there's enough time. You can complete the theory, yeah? Because you will anyway pass the exam, some good students, but you should be able to score a high mark. That's the most important thing. Right, so then we'll start with that. Okay. Good night, guys. Right, if there's anything, let us know. Right, okay then. Right, fine.